Good afternoon, everybody. Welcome to today's webinar, OVC Fiscal Year 2018 Advancing Hospital-Based Victim Services, hosted by the Office for Victims of Crime. At this time, I would like to introduce you to today's presenter, Sharon Fletcher, Lead Victim Justice Program Specialist for the Office for Victims of Crime.
Good afternoon, everyone. Thank you, Mary Jo, for that introduction. And thank you, everyone, for joining us this afternoon for the webinar. I'd like to first give us a little overview of what we're going to talk about today. We can walk through our agenda for our webinar. We're going to start with just a brief overview of the Office for Victims of Crime, or OVC. I'm a Fed, so I like to speak in acronyms, so please bear with me. I will try to make sure that I sound everything out. But after that brief overview, we are also going to, of course, walk through the solicitation, which is the point of our time together this afternoon. So we'll review Purpose Area 1, the demonstration projects, and Purpose Area 2, the technical assistance project. Then we'll move on to talk about eligibility for the solicitation, review our application deadlines and review criteria, as well as how to apply. And then we'll go through a little Q&A session at the end where you'll have time to ask questions about all that we've reviewed so far. So as I said, we're going to start with our overview of our mission at OVC, which is very important. We are very much committed to making sure that we are enhancing the field's ability to assist crime victims and providing leadership and changing attitudes, policies, and practices to promote justice and healing for all victims. So this is very much ingrained in all of the work that we do, and making sure that we are being thoughtful about providing services and support to crime victims wherever we can. So that directly ties to our mission of the Department of Justice and the reasoning behind this solicitation. So I also want to just pause and say everything that I'm going through is outlined in the solicitation, so I'll point out page numbers as well as we go through. Right now I'm literally on page 4, but just to give you some background of the rationale behind the solicitation and what brings us to putting out this request for funding. We know at OVC that we're committed to making sure that all crime victims are able to access evidence-based services and support that allow them to begin their physical, emotional, and financial recovery. But we also know that there are some serious challenges out there to victims across the board in getting the help and support that they need to help them through that difficult time. So those huge hurdles that we know exist are supported and seen through various surveys that we've put out and that we work with some of our partner agencies to put out, such as the National Crime Victimization Survey that shows us that only 12% of victims of violence ever access help. And then for those that we know don't report, which unfortunately is a large number of folks who do not report that they're victims of crime, that number only drops to 4% who are actually connected to services. So we know, and we've been able to kind of measure and reflect over the years to see how it is, again, an enduring challenge to connect those folks who are affected by crime to healing services and supportive services that are helpful for them. And then we also know, and there's other studies that show that more than 1.5 million victims each year are coming into hospitals and other medical facilities from violent injuries and are seeking support and services. So putting these two things together, we thought it just makes so much sense for us to be able to support the use of hospitals and other medical facilities as a wonderful entree point for folks to be able to connect with services. And so that brings us to this solicitation, which, again, OVC is putting out as it furthers the department's mission to improve linkages between the victim services field and hospitals, to increase support for crime victims, improve their outcomes, and hopefully, in the long run, reduce chances for future victimization. So with this solicitation, our goal is to support evidence-based models, practices, and policies that improve partnerships, again, between the victim service field and hospitals and related medical facilities, again, to increase supports for crime victims. And again, the aim of these partnerships is to provide comprehensive, coordinated, trauma-informed services and support that address the full range of victim needs. So through this solicitation, we anticipate we're funding up to 8 demonstration sites to implement or expand hospital-based or affiliated services that support crime victims, as well as at least 1 technical assistance provider that's going to provide comprehensive technical assistance support to the demonstration sites that are selected through the solicitation. And we'd also like that TA provider to develop additional tools and resources that support the effort and further the field. So now we'll move to delve a little bit deeper and talk about Purpose Area 1, and that is for the demonstration project applicants. So again, we anticipate funding up to 8 demonstration projects that will be funded for up to $950,000 each for a 24-month period. These projects will be funded to implement or expand hospital-based and affiliated programs that support crime victims. Applicants will have option to either support all victims of crime, so you'll have the option of supporting those who are identified as crime victims as they are coming in and seen, or you'll be able to narrow that by population. So examples that are provided in the solicitation include youth, just serving youth, serving adults, older adults. So it's really up to the applicant to make that decision on how or which types of populations of victims they will be serving. And then applicants will also have the option to choose to focus on specific areas of victimization. And an example of that are stabbing, shootings, or like human trafficking. So just to pause on those 2 points, I do want to make sure folks, and I encourage folks to know that you need to, or I would encourage you to be realistic in what you say you're able to support in your application, because we don't want you to, we have lots of language in here that says what we want, but we want you to also, tell us truthfully what you're able to support. So don't overreach. If you know that your program only focuses on a specific area of victimization or a specific population, that's fine. But of course, we're just trying to expand and reach folks who are able to do as much as possible. But we don't want you, again, to overstretch in your application what you're able to do. But again, programs serving multiple areas of victimization are definitely supported. And everything that we fund, of course, we anticipate having all of the services offering what we refer to as a victim-centered approach. And by that, we mean that all of the projects must respect the decision-making independence of crime victims, support their self-sufficiency, and promote victims' feelings of increased safety and well-being. So those projects should also offer an array of services that support crime victims, and there are many complex needs that would include safety planning, crisis intervention, referrals to community-based victim services, including crime victim compensation support, referrals to social services, providing victim advocacy, and court support, emotional support, grief counseling, and things of that nature. So we do anticipate that those projects would have partners that support all of those types of needs, and we also understand that that would include collaborating with victim-serving organizations. So we do understand that collaborations with partners would be a very important aspect in your application. We hope that our applicants will also include one or more hospitals medical facilities and encourage you to do that in your application. One area where demonstration projects are required to have a partner, and that is we are asking all applicants to partner with a local research entity to track and evaluate their efforts. And we're also allowing applicants to budget up to $100,000 per year to support that local evaluation effort. We're requiring applicants submit a Memorandum of Understanding, or MOU, or a letter of intent from your local research partner with your application. So a few examples of, and these are all listed on page 6 in the solicitation, but a few examples of potential projects. And I will also stop and say that we're not restricting applicants to only applying or only supporting projects in these areas. These are just provided as examples, and we definitely encourage you to be as innovative as possible. We also understand that OVC doesn't necessarily know everything that's going on in the field, so we anticipate that you all are using innovative approaches that aren't listed here. But just for the case of example in what's provided in the solicitation, some of those examples that we had in mind were creating trauma-informed services and support for survivors that are identified by program advocates or care managers and staff that are when they're entering the hospital emergency rooms or urgent care facilities, funding positions and training for hospital and program staff on the use of screening tools and other methods used to identify victims in trauma. And that's, that training piece is one that I've heard come up in a number of areas across the field. So I'm hoping that resonates for you all. Conducting training for medical staff in using victim-centered approaches and trauma-informed approaches as well when working with survivors in hospital settings is another example of potential project areas. Expanding hospital intervention programs that provide a network of support services for survivors. And lastly, using multidisciplinary teams linked to hospitals to identify and address service gaps and barriers that improve participating agency responses. So again, these are just listed as examples, but not limiting what you're able to apply for. Next slide. Some of the proposed activities that we anticipate applicants will complete during the course of the award would be identifying and hiring a project lead to coordinate and lead the project, identifying program partners and developing those MOUs or letters of intent that we just talked about to really solidify those partnerships for services to support the victims that you're working with and clients that you're working with. We also anticipate that applicants would work in conjunction with the identified TA provider that we intend to fund through this same solicitation, and they would work with that TA provider to strengthen their proposal, develop a strong plan to sustain these efforts after those grant funding is ended. We are also hoping that, or anticipate that sites will work to develop a logic model, and this is partially why we have asked that you work with a local research partner, because we see that as being an obvious place for them to support the development of that logic model, to illustrate how the grantee will monitor and evaluate the project, and as well as identify evidence-based practices for use in the program. And lastly, we anticipate that demonstration applicants will establish data collection processes to support the implementation process evaluation and reports developed on the project. And again, that's another area where we anticipate that partnership with the local research partner would be useful. Moving on to our Purpose Area 2, the Technical Assistance Project, we anticipate making one award for $2 million for a 24-month period, and that TA, or Technical Assistance provider will support all of our demonstration sites that are funded through the solicitation, as well as develop tools and resources to support the initiative in general. So you might wonder what we mean by comprehensive TA. So this is all outlined on page 8 of the solicitation. But some of what we include as comprehensive TA support, and it's not limited to this list, but what we see that including is providing diverse subject matter expertise and assistance to the sites. And that will be particularly important because we don't anticipate that all of the demonstration sites funded will be working in the same area. So although they'll all be providing hospital-based services, they will be we anticipate they'll be serving different populations and different types of victims. So we're hoping that the TA provider that is selected will be able to support an array of programs that are serving victims in a number of ways. We are also hoping that the TA provider will be working with the sites to engage partners and strengthen those demonstration site plans, providing comprehensive, coordinated, trauma-informed TA services, and very importantly, facilitating peer learning exchanges among the sites so that the sites are actually working with each other and learning from each other to problem solve and create innovative new ideas to enhance services for crime victims in, of course, hospital-based settings. The successful applicant for the TA project will also be required to work with our other OVC TA providers. Our OVC Training and Technical Assistance Center, also lovingly referred to as OVC TTAC, is one of the more obvious entities that we anticipate this provider would be asked to coordinate with. However, I think right now OVC has over, I want to say 30 TA providers that we're working with, perhaps more after this funding cycle. So we are hoping that, and we anticipate that whoever is selected through the solicitation will, of course, be brought into that fold and support coordinating with that so that we can leverage that learning with our demonstration sites and maximize the effectiveness of the TA, and, of course, avoid duplication of efforts. One important resource that we think would be useful in our asking our TA provider to produce is a toolkit for policymakers and our Victims of Crime Act state administrating agencies. Pardon me. And so these are the agencies, the VOCA, and that's what Victims of Crime Act stands for there. These are the agencies that are administrating the formula grants that provide victim assistance and compensation funding. And in case just so you know, those VOCA agencies receive the bulk of funding that our office receives every year. So we think it's very important for them to understand how incorporating these public health approaches to improve victim outcomes are important to their work. And so we're hoping that this toolkit will highlight some of those strategies and kind of give them some how-tos on how best to do that and incorporating them into their overall work and grant-making processes. And again, that is one of the potential activities that we're hoping to receive from our TA provider that is selected. Next one. So again, some additional proposed activities from our TA provider, and this is all outlined on page 9 of the solicitation. Identifying a project lead and expert consultants to provide support for the demonstration sites. And again, it'll be very important that the consultants that they are working with are able, and as well as the main lead agency, are able to support our sites in a number of areas because we do anticipate having a broad range of services as well as victim populations served through the demonstration sites. We do want the TA provider also to be able to deliver that TA support in a number of ways and using a number of methods. So we do anticipate that being phone, web-based, and in-person training. The TA provider would be expected to perform all logistics to support the TA activities and events. So that would mean anything involving setting up web meetings, setting up in-person meetings, all of those types of activities would be covered under what we see as performing and taking care of those logistics to support the TA activities and events. Again, we also anticipate that our provider would develop that toolkit we just talked about to promote the application of public health approaches that improve outcomes for victims, and incorporating these strategies into broader responses to victims, and that, of course, is geared specifically to our VOCA agencies. We anticipate that the TA provider would also share emerging information about their initiative with the field through webinars and conferences, blogs, and other things. Just kind of getting the word out on the good work being done and helping to engage the field so that we are learning and growing together. We do anticipate the TA provider could provide logistics for an all-site meeting for each year of the demonstration initiative as determined by OVC. Of course, a big piece of this will also require the TA provider to have a plan to develop a system for receiving and tracking TA requests from the demonstration sites that allows OVC to assess user satisfaction with services. And then, of course, we definitely want to make sure that our TA provider is able to provide OVC with regular updates on the progress of the sites in their development and implementing their strategies. And that usually would entail anticipating having that project lead available and others that are working in this to support the effort in monthly calls and other meetings as needed to maintain contact with OVC and keep us up to date. So just to have a little time to go over eligibility for each of the purpose areas. For purpose area 1 for the demonstration projects, we anticipate we are allowing applications from state and local agencies, tribes, federally recognized tribes, nonprofits, including tribal nonprofits, faith-based and community-based organizations, colleges and universities, including tribal as well. So a wide range of applicants are eligible to participate in or apply for the demonstration project. The caveat, of course, is that the entity must demonstrate understanding of the area of victimization and support services described, as well as they must really have the staff resources and capacity to develop and enhance the programs proposed in the application. So, next slide. It's for the TA project, purpose area 2. Nonprofits are eligible. Nonprofits, that is, with the 501c3 status, colleges and universities, or public agencies, and that does include tribal nonprofit and tribal institutions of higher education. And these applicants must have demonstrated experience and understanding of the range of crime victims' needs, the ability to forge partnerships and represent that range of assistance, and, of course, the staff resources and capacity to provide TA to a wide range of victim-serving organizations and stakeholders. Eligible applicants have to apply to one purpose area or the other. We are not considering applicants that apply to both projects, so that's important to highlight. I will say the caveat to that is that a lead entity can be only one lead applicant per application. However, you can be a subrecipient on multiple applications. Organizations can be a subrecipient, but you cannot be the lead on multiples. And that's important to call out because we're not awarding the same applicants to work in both purpose areas. So just to make that clear. And lastly, one also area to call out is that any for-profit organizations must forego profit or management fees. So our application, our solicitation opened on May 30th, and it closes promptly on July 2nd. Unfortunately, it's a fairly short window, so I do encourage everyone to get started soon. And that, again, on July 2nd, our deadline is 11:59 p.m. Eastern Time. Next slide. So for our application review criteria, and this is outlined, it doesn't say on the slide, but this is all listed on page 33 in the solicitation. This just goes over all of the areas elements of the application and shows how they are weighted, because this is a competitive process. And it's important to also call out that documents that aren't submitted, a document you see listed, if they have an asterisk and they're not submitted with your application will not be considered. So it's important to make sure that those key pieces are submitted for us to review your application. As far as how to apply, all of the application processes must be, you have to register and submit the application through grants.gov, and that would include acquiring a SAM number and unique entity identifier, which is a DUNS number. And I should also call out that this is all outlined on page 31 in the solicitation under the registration and submission steps section. So after having that SAM and DUNS number, you'll also need to acquire an authorized organization representative and a grants.gov username and password. You have to acquire that confirmation for the AOR, or the authorized organization representative, and from the e-business point of contact. Then you search and access the funding opportunity on grants.gov and submit the application. So there's a link there that gives additional information for further details on DUNS numbers, SAM, and the grants.gov registration stop process. If you're familiar with applying through grants.gov, this probably doesn't sound too crazy. However, if you're new to our process, I must tell you, you really do need to start early, because some of these processes, such as the SAM and DUNS number, as well as they're calling out here the AOR, it does require approval and before you're able to completely submit the application. And I should also call out that we do not, OVC would not be able to allow additional time for you to have those approvals to submit your application. So you would need to have all of this done by that July 2nd deadline. Next one. So just a few tips I want to share to make sure everyone has a smooth and easy process, or to lead you to that. Start early. As I said, there's a number of pre-approval that are needed that aren't necessarily tied to your application, but to your organization that will be serving as the lead entity. Also, apply under the correct competition ID. We won't, since this is competitive, we will not be moving applications from one purpose area to the other if you accidentally hit the wrong thing. So it's important for you to make sure that you're applying your applications in the correct competition ID. Also, make sure that you're identifying the appropriate category in your submission. And by category, I mean Purpose Area 1 or Purpose Area 2. One other tip I want to say, I know I've heard from applicants in the past that had difficulty using the templates that are provided for the program abstract and budget detail worksheet. So I do want to make sure everyone is aware that use of those templates is optional. What you can do is to use that same format that's provided as far as the headings and subsections to complete that same program abstract and budget detail document in any word processing software that you have, such as MS Word. If that's the easiest way for you to do not get, I don't want you to spend too much time fighting through technical issues if you can just type it up differently and get it done. So just a tip. And then last, I will say, make sure you ask for the amount of funding needed. So there's no glory in asking for $400,000. We don't think that looks better. So we expect to make awards of the $950,000 for the demonstration projects and the $2 million for the TA project. So there's no glory in coming under that just for the sake of coming under that, because we want to make sure that you are putting forth budgets that are actually going to be able to meet the services required. So please feel free to ask for the entire amount if you are finding that that's the amount that's needed. Next slide. So now we've reached the Q&A time of our session. So if everyone could please, again, I'll remind everyone, use the Q&A section at the top to submit your questions, and we can get started.
So we do have quite a few questions here, and I'm going to kind of add on to what Sharon just said. Quite a few questions, I believe, went privately to the captioner. So if you could please readdress those questions, and when you're selecting who to send it to, please select all panelists. That would be really great. Also, if you submitted them in the chat box, if you could just kind of copy that over and put it in the Q&A box and send it to all panelists, that would be very helpful. Again, we don't want to miss any questions, and when they're coming through various sources, it's very easy for us to miss something. So, with our first question, if my organization is affiliated with another organization, I am a hospital-based program, and I'm working with Harvard School of Public Health researcher. Would it be appropriate, given that Harvard is affiliated with the hospital that runs the program I direct?
I'm sorry, I don't think I hear where the question is.
I'm guessing he or she wants to know if her organization could apply if they're also affiliated with Harvard. I believe perhaps you can submit a clarifying question if we're off the mark here.
Yes, well, I would say it sounds like that would not be an issue. Because again, universities are still eligible to apply for both the demonstration project and the technical assistance project.
Do you have a list of state contacts so that I can connect with the right state resource for crime victim data?
No, I do not.
Can hospitals be within the same system?
Yes. So there can be multiple applicants from a given jurisdiction. Or if they're connected programs, we do anticipate they would be in the same system.
Would an applicant be stronger if it focuses on more than one area of sexual assault, domestic violence, trafficking, or on more than one age group?
I think the answer to that is yes. We are asking, I don't know if it's necessarily stronger because there's still other areas where you would need to be able to show that you're able to support whatever types of victims and crime types of population and age groups that you're reaching. So I think the key is just to make sure that whatever you're saying you can do, you can show your application is able to clearly support how that's going to bear out.
How would you define local? Within how many geographical miles?
We don't have a designation for that. Local usually just means not state.
Is the $100,000 included in the $950,000?
Yes, that $100,000 per year is inclusive in the total $950,000 per year that demonstration projects are able to apply.
I think this question is, should the research entity or must the research entity be separate from the applicant?
No, that research entity would apply as part of the one application for that one demonstration applicant. So they would likely be the subrecipient.
Does a research entity need to have a secured MOU, or is a letter of intent okay for a grant submission? RFA seems to suggest the former.
The RFA does say a MOU, but given our short timeline for application deadline, a letter of intent is fine. But we do want to be able to, the key is to have something of note from that research partner that dedicates or shows that they are dedicated to serving as the local research partner for that specific applicant.
The RFP states the research partner must be independent and not connected directly or indirectly to the applicant agency outside of the agreement of the implementation evaluation. Does this mean that the partner cannot be an existing contractor?
I think it depends on what that existing contractor is. I think where we're trying to go with that is that we don't anticipate one agency evaluating itself. We would like them to have an objective partner that's outside of their umbrella.
I'm actually going to move this slide. I'm going to move this slide one more. We have information showing right now for grants.gov if you're having technical problems, and there's also contact information for the National Criminal Justice Reference Service Response Center. If you have any questions that need to be clarified or questions after today's event, you can submit them to NCJRS. Can a demonstration project at a hospital include off-site temporary housing assistance for crime victims?
Yes, and that would fall under what we call a comprehensive array of services that meet the range of victim needs.
If you receive VOCA funding for program services, are you still eligible to apply for both TA and the demonstration initiative?
No one is eligible to apply for both. You have to select one purpose area. Each applicant has to select one purpose area. So you would have to apply for either the demonstration project or the technical assistance project, and that's not dependent on you receiving any additional, state-level VOCA funding.
It seems that there is not a requirement for a researcher evaluator for the TA provider also. Is that correct?
That is correct. There is no requirement for a researcher evaluator for the TA project.
If there is not a requirement for the TA provider to have an evaluator, will there be any sort of evaluation of the entire project, including the TA planned at any point?
That is yet to be determined. However, we do anticipate that everyone who applies, either for the TA project or for the demonstration project, we anticipate those that apply and are selected would be available to participate in a national level evaluation of the project in the future should OVC choose to implement one.
Will either projects that employ already established evidence-based best practices or projects that intend to develop new replicable evidence-based practices be given priority for funding?
I wouldn't say that you'd be giving priority. However, that does sound like a strong application.
When you say grantees must forego management fees, can you define what management fees are specifically considered? Does this include indirect costs and or itemized personnel or operating costs that relate to the administration of the program, such as accounting?
No, that does not preclude forego of profit or management fees. Basically means that you're not allowed to make money from the project. Since this is a federally funded program, we anticipate that all applicants are engaged in the work to help others and not to make money. So that's really where that language comes from. Applicants are, of course, allowed to apply indirect costs if they have such agreements, and to use funds to support management of the overall project, including accounting.
The language suggests that MOUs and collaborations will be done after the grant is awarded. Is this true? What sort of timeline is expected in terms of planning and then delivering program services?
We anticipate that the MOU or letter of intent for the research partner will be submitted with the demonstration applications. I believe what you might be referring to later in the solicitation is we anticipate that over the life of the 24 months of the project, that additional partners and MOUs may come into play as you are expanding or growing your work. And we anticipate that regardless of when those MOUs or letters of intent are submitted, be it with the application or during the life, that everything would be active. Well, the ones that we are collecting at the beginning with the application, we anticipate would be active during the life of the grant, which would be the 24-month grant period. And then those that are created during the 24-month period would be active for the appropriate amount of time, depending on when they are enacted.
Can subrecipients be other community agencies who might begin serving a specific subset of victims?
I believe that answer is yes. So yes, subrecipients can be other agencies that are partners to your lead agency.
Are indirect costs federally approved rate included in the $950,000 cap?
Yes, indirect costs are included in the overall award amount, both for the demonstration projects, which is the $950,000, or for the TA projects, which is $2 million.
If we have a DUNS number for Illinois, does that apply for this grant?
I think the DUNS number is tied to the applicant agency, so if your applicant agency uses that DUNS number, then that is the one that you would use.
Does the evaluation partner need to be a separate entity from the primary applicant? In other words, can the applicant evaluate itself if they have expertise in evaluation?
And the answer to that is no. We do anticipate that the evaluator will be a separate and objective entity.
Just to confirm that a nonprofit community hospital is eligible to apply as the lead applicant.
Yes, nonprofit hospital are eligible to apply for the demonstration projects as the lead applicant.
Is the $924,000 for each of the 2 years, or $924,000 for the total of 24 months?
The demonstration projects are able to apply for $950,000 for 24 months total. So that's the total amount, including any carve-outs for the local evaluation, indirect costs, and everything. That is the total amount of funding available.
Can a university submit more than one application if they come from different departments within the university?
Yes. So different departments can submit applications for the demonstration project or for the TA project. I would suggest that that might not be a good idea for you paperwork-wise, because that's a lot of duplication. But if you feel like that works best for you, then you are able to do that.
One of our key partners is a university research institution. Would the partner be permitted to charge its indirect cost rate established with the federal government?
Yes. Your subrecipients are able to charge indirect costs. That's really like whether or not you would want to have that included would really be up to the lead applicant to decide what makes sense for them.
I think this question, they're saying so up to $475,000 a year. I think they're trying to ask if that's what the amount is per year. I'm not sure. For the demonstration projects, it's a $950,000 grant over for 24 months. So you can break that down as you see fit to cover the 24 months. If you want to break it down evenly in half, you can. If it doesn't break down evenly in half, that's fine too. But the total amount, the maximum that you would get
is $950,000.
The next question I'm going to take, where can I find the RFP? We actually put a link to the solicitation, and it's in the chat box. So it was entered at the beginning of the webinar, so if you scroll up, you should be able to see it. And you can also find the solicitation on ovc.gov. Go to the link that says funding, current funding opportunities, and you'll be able to scroll down there, and you'll see this solicitation. Can you choose 2 hospitals within the same system?
Yes. You can definitely use multiple hospitals in the same system.
Can you apply if you're not a profit? Can you apply if you're a not-for-profit hospital?
Yes, you can apply if you're a not-for-profit hospital.
Do the MOUs have to be with a hospital? In my area, there are no hospitals, only clinics.
The MOU that is submitted is actually for the local research partner, so no, that does not have to be a hospital.
Can funds be used for capital equipment or rent?
Funds can be used for rent. I'm not sure what capital equipment means.
Will I find the entire application and instructions on the OVC website? You referred to page 8 and other pages.
Yes, the solicitation, again, is available on the OVC website, ovc.gov, under current funding solicitations, current funding opportunities, and it was also shared in the chat, a link to it as well. Would a Planned Parenthood provider be considered a healthcare partner? Yes, they could be considered a partner.
You mentioned a few times working with a researcher for the evaluation, but the instructions made it a point to clearly delineate between research and evaluation. Can you please clarify?
I'm sorry, we're not researchers, so we use them interchangeably, but a local research partner and a local evaluator is the same. I know everyone who's more versed in this area is cringing when I say that, but it's not our lane. We basically mean that you need to have a local partner who is skilled in this area working with you to evaluate your program. We don't anticipate that it's necessarily pure research in the purest sense, because we are asking for an implementation or process evaluation. We are not asking for the gold standard in evaluation. So I'm hoping that was adding some clarity. I'm sorry that we may have muddied the waters there.
Can a local police department victim advocate office partner with a local hospital for PA1?
Yes, you can have any number of partners for the demonstration project. So that could include a local police department advocate or any number of other places.
If a hospital system applies for a program at one of its facilities, is it true that the research arm of the same health system cannot be used for the research piece?
Well, again, we anticipate that the researchers that you're working with or the local partner, local research partner is a separate entity. So that's the requirement.
Can you also define what constitutes a management fee that would not be an allowable cost?
Off the top of my head right now, no. Again, that language specifically is included because we understand that hospitals sometimes are for-profit entities, but in regards to this program, we do anticipate that if awarded, the hospital would not be making money off of the program, off of this specific program. So that's just to clarify, that's what that is about. I don't necessarily know that of a specific management fee that wouldn't be included because we don't fund them.
Our organization has its own primary care clinics, a hospital, research and evaluation department, and a grant department. Must we still hire an external evaluator?
Yes, you must have an external evaluator, and there's no context where that evaluator cannot be external.
If the program is a current recipient of a DOJ OVC funding for a different project, will this present a conflict for the submission under a new funding opportunity?
No. If you're already currently an OVC grantee or a grantee from any of our other sister agencies, there's no conflict. You are still eligible to apply under the solicitation for either purpose area.
Can you explain the limitations of indirect costs?
I don't think I can answer that. I'm sorry. You can also call our office for our financial office's customer service line for information on indirect costs, but it's generally just the administrative type of a fee that you either have a federally approved one. I know under the new circular they do have some allowances now for a minimum indirect cost rate, but that's not my area of expertise, so I would defer and refer you to the OCFO customer service line for more information on that.
And I switched the slides. There's some websites listed on the current slide, and one of them is for the DOJ financial guide, where you can find more information about the indirect cost, and I believe there should probably be contact information once you get to the financial guide. The RFP implies an award of up to $950,000 for a 2-year project, but the person answering just said $950 a year. Please clarify.
No, I did not say a year. I said for 2 years. So for the demonstration project for Purpose Area 1, it is $950,000 for a 24-month or 2-year period. What I did say is if you want to break it down as an even half for that one question where they said $475 a year, it can be that, but you can make that fit as it applies to your project. It doesn't necessarily have to be an even split per year, is what I said.
If an applicant is a hospital at a university, can the researcher be a different center school for the same university?
No, we would like for your research partner to come from a different, again, non-affiliated organization, because we do want to make sure that we maintain that autonomy between the program and the local research partner.
To clarify a previous question, my hospital receives VOCA funds for limited services. Are we still able to apply for the demonstration project to enhance services?
Yes, you are. So again, if you're currently a grantee from OVC, from another federal agency, or from a state agency that does victim services, you're still eligible to apply for both the demonstration project under Purpose Area 1 or the TA project under Purpose Area 2.
Could the TA provider propose holding a peer learning conference for the site?
Yes, the TA provider can propose that, peer learning conference.
Does OVC consider hospital-based violence intervention programs as described in the literature as evidence-based?
Yes, we do.
Can a previously piloted program be reinstituted with these funds, or must they be completely new? The pilot was successful, but not refunded by the original funder.
If the previous program meets the criteria of either the Purpose Area 1 demonstration project or Purpose Area 2 technical assistance project, then yes, you can apply.
Is there a percentage allowable for administration costs?
We don't have that requirement as far as a benchmark for that. Ordinarily, that might be included in indirect costs, so if you have an approved indirect cost rate. However, you are also able to charge directly for, again, the project leads that we did ask for each area to have identified, and you're also able to pay staff as needed for other support options, be it admin, accounting, or any of those other needs as well.
We have a couple questions that are worded differently, but they're pretty much the same. Again, people are asking to clarify if they currently receive VOCA funding, if they're eligible to apply. Anyone, no matter what grants you receive from anybody, be it at the state level or federal level, you are eligible to apply. What is the earliest if we're starting from scratch, no DUNS number, SAM number, et cetera, to get these approvals? I think that's going to vary because those approvals for the DUNS and SAMs and AOR aren't done by OVC or even DOJ. So there might be different days for feedback on that. And again, you can refer to the link on the slide for additional information for how to reach out and start that process for each of those. I'm not sure. I can't be more specific on a turnaround time. Okay, if you could just give us 1 second, I need to search through and see if we're missing any questions. Okay, at this time we do have some questions left, but we are at the 4 o'clock hour, so we need to end the webinar. Those of you who your questions were not answered, please submit them to the National Criminal Justice Reference Service, and I'm going to put that slide up again. The email address is very simply grants@ncjrs.gov. And you can also call them at 1-800-851-3420. I'm going to leave this slide up here for a few more seconds so that you can write that information down. It's probably good to have both the phone number and the email address so that you can reach them either way. They do have operation hours listed here from 10 a.m. till 6 p.m. And then the date the solicitation closes, they're open till 8 p.m. But as Sharon has already stressed, don't wait till the last minute. So hopefully you're not calling for questions at 8 o'clock the day that the solicitation closes. Okay, so with that, we're wrapping up. I do want to thank everyone for your time this afternoon. I'm very excited to see the number of attendees who were able to participate today. We're also excited for this opportunity to provide additional funding to support crime victims and expand the amount of services out there to help those in need of support. So thank you so much for your time. Thank you to Michelle and to Mary Jo behind the scenes for helping us pull together tonight's afternoon's webinar, and good luck to everyone who intends to apply. And one last thing, and we will hang up. The slides and the transcript will be posted to the OVC website. You will receive an email letting you know that that has been posted. You can also just go to ovc.gov and check back and see if it's there. That is it then. Thank you, everyone.